rising cost of health care is among Americans' biggest worries. Insurance coverage for prescription drugs has been decreasing as their prices have been increasing.
We pay 3 times as more for medications than they do, 3 times more on average, and in many cases it's much more than that. Well, drug manufacturers say, well, we need the money to justify research and development.
And prescription drug prices in the U.S. averaging nearly 3 times more than in other countries.
We would obviously assume that we're going to buy it for less. But no, instead we're paying over $200 more just to bring it into the store.
The same pill, the same manufacturer, the same dosage. In the United States, it costs $300. In Canada, $30. In France, even less. That's not an exaggeration. A federal study commissioned by the Department of Health and Human Services found that Americans pay 2.78 times the average price of 33 wealthy nations for the exact same medications.
In Germany, the pharmacists tell you to it's $60. In Canada, maybe $150. In America, that same box, that same dosage from that same manufacturer rings up at $1,500.
For brand name drugs, it's 4.22 times higher. And for insulin, the drug 8.4 million Americans need to stay alive, the U.S. price is nearly 10 times the international average. Today, I'm breaking down exactly where that money goes, who's profiting from the gap, and why 43% of Americans are now skipping their medications because they can't afford them. Let's get into it. Let me start with the government's own data, because this isn't a matter of opinion. The Rand Corporation, working under contract for the federal government, published the most comprehensive international drug price comparison ever conducted. They analyzed pricing data across 33 OECD countries using 2022 pharmaceutical sales data. Their headline finding: U.S. drug prices are 2.78 times the average of those 33 nations. For brand name drugs specifically, the multiplier is 4.22 times. The one exception, unbranded generics, where the U.S. actually pays less, at 67 cents on the dollar. And here's the number that puts the full picture into focus. The United States accounts for 62% of total drug spending among the nations studied, but only 24% of the drug volume sold. Translation: Americans are buying a quarter of the world's pills, but paying for nearly 2/3 of the global bill. Let me make this concrete. Eliquis, one of the most commonly prescribed blood thinners in America, costs roughly $7,100 a year at U.S. list price. In Canada, it's $900. In France, $650. In the UK, $760. Same drug, same manufacturer, same pill. Stelara, used for psoriasis and inflammatory bowel disease, runs about $79,000 a year in the U.S. In France, it's $12,000. In Japan, $14,000. And insulin, the drug that's become the symbol of this crisis, costs $98.70 per unit in the United States. In France, it's $9.08. In the UK, $7.52. In Turkey, $2.64.
Some specialty medications costing tens or even hundreds of thousands of dollars per year, and prescription drug prices in the U.S. averaging nearly 3 times more than in other countries.
In 2017, a 26-year-old named Alex Smith aged off his parents' insurance. His insulin cost $1,300 a month. He tried to ration it to make it to his next paycheck. He didn't make it. His body was found in his apartment 3 days before payday, dead from diabetic ketoacidosis. His mother later testified before Congress. His death led directly to state and federal insulin price reforms.
But without insurance, Alex Smith couldn't afford the $1,300 a month to control his diabetes. So he tried rationing his insulin. Empty vials found near his body.
The Loan Institute estimates that 1.3 million Americans are currently rationing insulin because of cost. Among the uninsured, nearly 1 in 3 ration. So why is this happening? 3 structural reasons, and none of them are complicated. First, and this is the elephant in the room, the United States is the only wealthy nation on Earth that does not regulate drug prices. In Canada, the patented Medicine Prices Review Board caps prices based on international benchmarks. In the UK and across Europe, governments negotiate directly with manufacturers. In Japan, prices are set by the government and reviewed regularly. In America, pharmaceutical companies set their own prices. Second, the middlemen. 3 pharmacy benefit managers, CVS Caremark, Express Scripts, Himri, and Optumar, process nearly 80% of the roughly 6.6 billion prescriptions filled annually in the U.S. The Federal Trade Commission investigated them and found that between 2017 and 2022, these 3 PBMs reaped $7.3 billion in revenue by marking up specialty generic drugs at their affiliated pharmacies, in some cases by hundreds or even thousands of %.
Patient buys a drug in the top tiers, the PBM gets a rebate. The more expensive the list price of the drug, the higher the PBM's rebate tends to be.
And third, patent evergreening. AARP analyzed the 25 most expensive brand name drugs in Medicare Part D and found they'd increased by an average of 98% since market entry, nearly doubling in price. Eli Lilly's Trulicity, 100% increase since 2014 versus 33% general inflation. AbbVie's Linzess, 154% increase since 2012 versus 36% inflation. Now, to be fair, the pharmaceutical industry argues that high U.S. prices fund the research and development that produces breakthrough treatments for the world. And there's some truth in that. The U.S. does lead in drug development, but when Eli Lilly makes more money from Humalog insulin in the U.S. market alone than from the rest of the world combined, the U.S. accounting for 31.6% of insulin consumption, but 83.8% of global insulin sales revenue, the subsidy argument starts to look less like R&D funding and more like a pricing strategy. And this brings us to what these numbers actually do to people. A new KFF poll from March 2026 found that 43% of Americans say they skipped taking medication as prescribed in the past year because of cost. GoodRx's 2025 prescription cost burden report found that 20% of Americans are rationing their medications, up from 15% the year before. One, and 13% stopped taking a medication entirely, up from 8%. The West Health Gallup Healthcare Affordability Index hit an all-time low. Only 55% of Americans can afford and access prescription drugs and quality health care. And 11%, approximately 29 million people, are classified as cost-desperate. On Reddit, one user in the ADHD community documented how their medication went from $50 a month to $90, then suddenly to $372, despite paying $800 a month for health insurance that was supposed to cap specialty drugs at $250. Another Medicare beneficiary wrote that they paid $560 for a 90-day supply of Eliquis through their Part D plan and assumed that was the negotiated rate. Yet it was still double what Canadians pay for the brand name version. And the Gallup data that should haunt everyone working in this system. 34 million American adults know someone who died in the past 5 years after not receiving needed treatment because they couldn't afford it. Now, to be fair, things are starting to move. For the first time in history, the federal government negotiated directly with drug manufacturers on pricing for Medicare. 10 drugs were negotiated for 2026. With discounts ranging from 38 to 79% off list price. Januvia dropped 79%, Enbrel dropped 67%, Novolog insulin dropped 76%. But here's what Peterson KFF found when they compared those new negotiated prices to what other countries pay. Even after Medicare's historic negotiation, the U.S. negotiated prices are still 2.8 times the average in 11 comparable nations. Jardiance, the negotiated Medicare price is 3.9 times what peer countries pay. And California is going further. The state launched the first state-manufactured generic medication in America. CalRx insulin pens are available for $11 each. Brand name Lantus retails for over $400 uninsured. Here's the truth. Americans pay 2.78 times the international average for the same medications. 3 pharmacy benefit managers control 80% of all prescriptions while marking up prices by billions. And 43% of Americans are now skipping their medications because they can't afford them. If you're on Medicare and one of your medications is among the first 10 negotiated, the 2026 prices will bring real relief. But even those prices are nearly triple what other countries pay. If you're paying out of pocket and haven't checked Good RX, Yas Cost Plus Drugs, or your state's pharmaceutical assistance program, you could be overpaying by hundreds of dollars a month. If you're an insulin user, the $35 monthly cap for Medicare beneficiaries and California's $11 pen may change your math entirely. And if you're watching a parent or spouse ration medication to stretch a prescription, the data in this video proves it's not their fault. This is a system that charges Americans more than anywhere else on earth for the same product. I'll be covering the Medicare enrollment traps that cost thousands, the insurance crisis crushing retirees, and the hidden healthcare costs of retirement. Subscribe to Why with Harlan so you don't miss the next breakdown. Thanks for watching. That's the Why. I'm Harlan. See you in the